I'm Dr. Moses, and this is Transformed. I'm holding this in my hand for no reason at all. This is something my daughter made for me when she was 12. Aw. There's a scripture on the back. Deep calls to deep at the roar of your waterfalls. All your breakers and your waves have gone over me. Whew. Okay, let's talk about Seroquel. First of all, sleep hygiene. First of all, Seroquel is not a first-line treatment for insomnia. This has to be, we've tried other things haven't worked, and you've got to be focusing on your sleep hygiene. Seroquel or Quetiapine has side effects, major weight gain. I'm talking weight gain, obesity, high blood pressure, diabetes, heart attack, stroke, the whole thing, metabolic syndrome, fatty liver, elevated triglycerides and cholesterol, all because of the weight gain from Seroquel. So we don't want to use Seroquel or take it lightly. Only take it if you really need it. Now, Seroquel is the big guns. So, first of all, focus on sleep hygiene. Again, I cannot emphasize this enough. Wake up at the same time every day, get sunlight in your eyes in the morning, exercise, avoid naps, avoid stimulants, especially after afternoon stimulants, and then go to bed. Only be in bed for 8 hours per day. So if your wake up time is 7 a.m., you should be going to bed at 10:30, 10:45, so you can fall asleep at 11 p.m. and wake up at 7 a.m. and get out of bed. Okay? If you're following the sleep hygiene rules, you will sleep. 99% that you won't need medications. If you still do need medications, only use them as needed. Keep focusing on your sleep hygiene. Okay, back to Seroquel, Quetiapine. We're going to call it Quetiapine now. Quetiapine is an antipsychotic, okay? So that means it's used for hearing voices and for having delusions, for hallucinations. Schizophrenia, bipolar, mood stabilizer. That's its main function. Now, it does make you tired, so we can use it for sleep. The dosing that we're going to use for sleep is going to be on the lower end. The lower doses are going to be more effective for sleep because that's when it's more effective with the antihistamine properties and alpha blocking properties. So those lower doses are going to be 25 or even 12.5, 25, up to 100 milligrams per night. More than that, you're starting to move into more of the antipsychotic effects of Quetiapine. And that can start to change your sleep structure, may or may not help. There's really a drop off. It's not helping with sleep past 100 milligrams, generally speaking. So it's best at a lower dose. Side effects, once again, most importantly, weight gain. You can gain a lot of weight on Seroquel, which can cause obesity, abdominal obesity, fatty liver, high triglycerides. This is called metabolic syndrome, high blood pressure, and then all of these things can lead to an increased risk of heart attack and stroke and death, right? And then the obesity itself also leads to many other myriad of problems like arthritis, being sedentary, not moving, social issues, all kinds of things. So you've got to really watch your diet, watch your food, and be exercising and weigh yourself at least twice a week and monitor your weight if you're taking Seroquel. Remember, what gets measured gets managed. So if you measure, then you have a better idea on how to manage your weight. The other thing with Seroquel, actually two more things, is orthostasis. So Quetiapine can also cause a drop in blood pressure, again, especially at night or when waking up in the morning. So if you get up at night and you need to go to the bathroom, get up slowly, hold on to something, make sure that you're not dizzy or you're not going to faint. The same thing in the morning. If you took Quetiapine at night before bed, when you get up in the morning, get up slowly, hold on to something, make sure that you're not getting dizzy or feeling like you're going to faint. If you do feel dizzy or feel like you're going to faint, just lay back down. That's the safest thing you can do, and call someone. Okay, last side effect for Seroquel or Quetiapine is what's called QT prolongation. So we want to be careful when combining with other medicines that prolong the QT interval. This is medical jargon to say that it can cause heart arrhythmias that can be life-threatening. So if you feel your heart rate slowing down, any chest pain, something not feeling right, tell someone right away. And for my providers, we're not combining QT prolongation drugs together. So that's Quetiapine. Follow your sleep guidelines. Focus on your sleep hygiene so that you don't need to take these medicines for sleep. And when you do take them, only take them when you need them. Thank you so much.